and the other one, and hold. And so finally we tested your forehead, which is stress. The lovely energies of the cranial bones. So this is a tuina massage, Chinese rocking technique, isolating the shoulder, isolating the scapula, and making sure it's got good full round flexibility. Again into that neck of the left toe and the pulse of the cerebral spinal fluid. And a little qigong, getting some light in there. Okay, heavy, 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 heavy. And let go. Let your head tip all the way back. Beautiful, okay. So we're going to do some kinesiology first of all, which is muscle testing. Can you raise this arm for me? Lovely. I'm going to push at the wrist, and if you could resist me, stop me pushing, and hold. Okay, and this one, and hold. Okay, can you raise a leg for me? I'm going to push here and hold. Nice. And the other one, and hold. Okay, can you raise two together, arm and leg, and hold. Okay, and the other side, and hold. Okay, so we can see some weakness there, but there'll be a reason, and it's a difficult one. I almost want to see a weakness because then I know what to do about it, and I know it's going to be A, B or C. It's fine if you come in and pass every test, but that would be very unusual with your first core therapy.
Right.
So I'm just going to pull your hair. Can I have this arm and leg again? And hold. Okay, so not much different. So you're not dehydrated. Okay. Have you been drinking water today?
Yes.
Not much?
No, I've had a pint of squash. I'm just trying to remember.
Okay.
Yeah.
Okay, that's a good start.
Couple of cups of tea.
Dehydrating.
Oh, okay.
Okay.
Oh, I think I remember you saying that.
Yeah. Well, tannin is used in tanneries for drying out liver, so it's very drying. Okay, so it's not that. So can you upturn a finger, touch the roof of your mouth if you're happy putting your finger in your mouth, the back of the domey bit. And then we're going to do this again, arm and leg. I'm going to push, you're going to hold up strong and hold. No, not much different. Okay, if you could release that. Can I have a little feel of the tummy?
Yeah.
Yeah. Sorry about my chilly hand.
That's all right.
Oh, feels okay. Sorry, I do go a bit deep.
Okay.
Okay, so can you put two fingers into where mine are? Strong in there, yeah. Arm and leg again, and hold. No, okay. Flat hand, can you touch your forehead? And hold. Aha, okay, so we've gone strong.
Okay.
Okay, you can release. So I'm going to backtrack and explain a little bit. So when we started off, I tested individual muscles first of all, and there was some weakness there, but that tells me I can't use them as a strong indicator muscle when I'm then checking other things further on in the treatment around the body.
Right.
But that's okay, it doesn't matter. I'm just trying to find root cause. So then I went on and tested your IPSI. IPSI, IPSI, means one side, so this arm and leg, and then this arm and leg.
Yeah.
You failed both, which is quite significant, but it's quite normal with your first core. So say normal, quite common. So I know it's going to be one of four things, mainly four things. Dehydration, it wasn't that. Then you touch the roof of your mouth, and that's a little joint in the head called the sphenobacillus enchondrosis, which is really important. If it's out or in, it needs to be in the right place. It wasn't that. Okay, so that's good that it wasn't that. Then we tested your gut, a little valve there called the ileocecal valve, which is really key in the workings of the digestive system. It wasn't that because you didn't go stronger when you were anchoring it. And so finally we tested your forehead, which is stress.
Okay.
And it was that. So it's all right. Stress can come out in many different ways in the body, and it's interesting as a therapist to see someone who looks perfectly fine and not stressed at all actually prove strongly for stress. And so much so that it's affecting your IPSI and a double IPSI. So I'm going to do a little beautiful, very gentle technique with you now to help remove stress, because stress can come out physically in the body. You might not feel it mentally, but there might be something going on mentally. So I'm just going to do a little technique with you, and then we'll go back and retest that IPSI and see if it's then strong.
Okay.
Okay.
Sounds good, yeah.
Yeah. So just touching into the frontal bone, to the forehead, just tuning into the lovely energies of the cranial bones, the workings of the head. This particular technique is called an emotional stress release. It's really interesting when doing this technique because a couple of things happen. The energies calm and settle. The breathing calms and settles. And when I always have my eyes closed and yet my breathing seems to mirror the breathing of the client. And there's generally a point about a minute in where there's a beautiful, it's like another level of energy. It goes so much deeper. So lovely. Almost don't want to let go. Okay, so we're going to go back and do that double test. So arm up and leg up together. I'm going to push, you're going to hold up strong and hold. So much better. I don't know if you can see that, but and hold. So much better. Wow. Okay, so you needed that. So we're going to do across you this time. So left arm, right leg, and hold. Brilliant, lovely, and hold. Okay, arms going down a little bit. Could be shoulder. Just going to raise this arm on its own. I'm going to push and hold. Nice, not shoulder. And hold. Oh, elbow. Okay. And again, and hold. Nice, lovely. Testing the left hip and hold. Lovely, good. And hold. Oh, okay, definitely the knee. And hold. Right, okay, interesting. So mid joints. So left knee, right elbow. I'm just going to look a little bit more detail at the elbow, see what it's telling me. Can you raise the arm and hold? Oh, okay, okay. So there's some twisting going on there. Just going to twist it the other way and hold. Yeah, it's okay there. Having a look inside and hold. Yeah, okay, so the lymph node could be the eczema. The lymph node, which is on the inside of the elbow, is having a little bit of a work on its hands at the moment, trying to get rid of some infection maybe, or some issue within the elbow. But it's interesting when it's a lymph node, because there's no lymph nodes further down the extremity, not in the wrist or the hand. This is the nearest one to here. When this is working, it's working for the whole of the lower arm.
Right.
So it could be anything to do with elbow downwards. So I'm just going to have a little feel of the outer side of the elbow and hold. Yeah, okay, so outer side and then underneath and hold. That's all right there. So it's here, here, and a twist. Okay, I'm just going to update my notes.
Could that be to do with me being hyperextensive in the elbows?
Ah, but if your body is happy being hyperextensive, it all depends. I mean, does it give you any pain or strains or? Ah, so in what way? You're able to move it around, are you?
I can twist it more and I can bend it more.
The wrong way?
Yeah.
So like that?
Yeah.
Yeah. My girls are like that as well. Oh, you know that? Yeah.
I think so, yeah.
Is Dan like it as well?
I don't think so.
Ah.
No. Maybe I don't know actually. I might just be unobservant.
I'll find out later. Okay, so and left elbow, right knee, and so with the left elbow, it's inside, outside top, and twist. Okay, we will work on that, and then going to have a look at the knee. So again, is it twisted? And hold. No, not that way. And hold. Okay, so it's coming that way. And hold. Not great. And hold. Good. Okay, absolutely strong. And hold. And the lymph is fine. Okay, so it's twisted that way and the inside. The anterior side. Okay, interesting. How is tummy, digestion, everything working okay?
Yeah.
Yeah?
Yeah, no issues.
Yeah, cool. Let me think. Anything else I need to check with you? Let's have a look at your posture. Yeah, so this hip's a bit raised. Just the hip. Let me just have a look at that. Raising this arm and hold. Okay. And hold. A little. And hold. Good. And hold. Oh, okay, yeah, so it is that hip. And hold. Okay, so it's just pushing. So that was right ACES. Was that sore when I touched the hip? No. Okay, okay. I just want to have a look to see if they're happy opening, and then I'm going to check the neck before you turn over. So can you put this sole towards this knee by bending that knee and rest it out? Yeah. Perfect. And then give me this arm and hold. Not too bad, a little bit shaky. And then the other way around. And raising and hold. Again, same. Okay. You just had a click then, didn't you?
Yeah, I do find my hips click a lot. Both?
Yeah,
I think so.
But no pain?
No.
Okay. No. Yeah. And you got good flexibility there?
I think so. Yeah.
Okay. Right, next. So I'm going to take this leg all the way out this way, up into the air. And then I'm going to try pushing down to the floor in that fashion, and you're going to stop me pushing, hold it up here, and hold. Yeah, that's good. It's a hard test, that one. And I'm coming out again and up. I'm going to push to the floor, you're going to hold up and hold. Okay, little bit. So I'm just going to have a little feel of your neck. Okay, yeah, it's quite tight, especially there. Okay. Is that sore there?
I wouldn't say sore, but a little tiny bit uncomfortable.
Okay.
Yeah.
Right, ballet. Okay, right. Can you put 2 fingers on your pubis symphysis bone, which is the bone dead centre, quite low down, hard bone, yeah? Can you raise an arm? I'm going to push and hold. Nice, lovely. Okay, that's good. Right, you can turn over. I'm just going to get some tissue. Thank you. There we are. Beautiful hair. So can you bend this knee? Can you raise the knee off the couch? I'm going to try pushing here. You're going to hold up strong and hold. Okay. Same the other side. And hold. Okay. So not bad, but there's a slight give there. So I'm just going to check the C2 in the neck. Yeah, that one. So that's protruding a little bit. Is that sore?
Yeah, a bit uncomfortable again.
Okay. So I'm just anchoring it so your body knows about it. Right, I'm just going to raise the couch a little more. Okay, you can relax now. No more tests till the end when we do a few retests of any that had failed earlier. So for now, I'm just going to do a little bit of TCM techniques, traditional Chinese massage. So this is a tuina massage, Chinese rocking technique, testing out the spine, seeing if it's bouncing and soft, moving against the heel of my hands, seeing what your muscles are like, feeling good. So this should prepare your back, spine, your body for a nice good walk next week. So give me some stats. How many days are you walking for?
I think we worked out that it's 7 days.
Okay.
So it's on the 5th day that we summit, and then we'll start coming down on the 5th and have 2 more days to come down. So a few more days going up. So yeah.
Okay. And do you know the stats on how high it is, how much you'll be climbing?
Yeah, so total it's 5895 metres.
5895, wow. So nearly 59.
And I think we start at just over 1,000 metres.
Okay, wow. Amazing. And what's the weather like there now at the moment?
In the town we're gonna start from, it's looking at about 28 at the minute.
Yeah, and clear skies, or?
Yeah, clear skies, bit of cloud. Doesn't look to be any rain, but obviously at the top we're not exactly sure what to expect. Some people are saying, only -2. Other people are saying up to -15.
Wow.
So yeah, we're prepared for the worst, but...
And you've got all the clothing to suit all weathers?
Yes, yeah, absolutely everything.
Yeah. And you don't have to carry much then, is that right?
No, we're just carrying the day bag, so water and a few layers, and Sherpas carry everything else for us.
Oh, amazing, aren't they? Incredible. Do you ever get Sherpas that are female?
I haven't seen any pictures or anything, so I'll be inclined to say no. But
I've never heard of any, but you'll let me know. Wow. So this area is feeling, compared to, I don't know if you can feel that, so this fascia here is a little raised and pronounced, whereas this is quite flat on this side of the same muscle. So I feel that there is some strain here that I'll be working on, probably to do with the spine. So I feel like the spine in between these two isn't giving as much as the rest of the spine.
right,
So it's just, so here's your bra line, it's just above that, in the sort of 3 or 4 inches above the bra line. Can you feel that when I'm pushing here? That's probably a little bit more tight than say here and here. So what we tend to do in tuina is we work on the area, we don't just go straight into the area that's tight, we work on the soft areas as well, because they will actually resonate their softness and good motion to the rest of the back. Yeah, so you've got some good motion here. What I'm looking for when I'm actually pushing the back itself is a good swing to the hips, so you can feel your hips are giving. And likewise, I'm helping the hips by working here, but as the hips are swinging, they're helping that resonance up the spine and helping each vertebra separate as well. Because what you don't want are the vertebrae moving together as one, like an iron bar. You need them to move separately. And just like it's helping the structure of the back and the spine, it will also, by freeing up the spine, be helping the digestive system to the front of this area of the lumbar, and the lungs to the front of this area here. Of course, the lungs are huge actually, and the heart, kidneys, liver, everything will be getting a really good shower of nutrition and blood supply. So these bones here, the scapula, are flat plates of bone, and quite often they can get toxins or free radicals, lactic acid sitting on top here, and without a good massage or particular movement to shift them, they just sit there very happily for a very long time. So I tend to do this technique to agitate them, remind them that they can move, they don't have to sit there all the time, and that helps the flexibility of your upper back and shoulder girdle as well. So just going to work on those shoulders and the elbow. This is the said elbow. So just relaxing the arm nice and heavy into my hand. Lovely. That's it, lovely. And this is a wing stretch, just isolating the shoulder, isolating the scapula, and making sure it's got good full round flexibility. And let it go. Nice. So a double wing stretch on both sides will help this part of the back as well. Oh, it's starting to give. Wonderful, much better. Okay, relax it down, good. Trying to get my fingers under that scapular edge. Good. Then a stepping stone walk all the way down the back. All the way to the beautiful sacrum, rocking it left and right. Stepping from one vertebra to another, down and then up the back. It's good, it's rocking, that's great. Loosening off that tightness. I'm just going to work a little on the scapula. You can see they're a little bit imbalanced. This one's lower and outwards, this one's inner and higher. Just going to work on their posture, their position with a little scapular qigong. Good. Okay, so working on the neck of the big toe, which also helps the neck of the body, releasing, removing any clicks and crunches, circling both ways, and then around the pad of the big toe, that joint, clearing from the kidney down to the ureter and bladder, and then warming, separating the foot, feeling into all the joints, especially the ball, circling it, and then the ankle, anchoring and rotating, allowing for the opposite hip to rise, to rebalance the pelvis. Lovely, good. Again into that neck of the left toe. Mobilizing, helping to separate it so it's not too stuck from the rest of the foot and joints, all the metatarsals. And then anchoring, holding, bringing the leg down, the opposite hip comes up. Lovely, good bounce. And then sacral fix. Letting both go. I've got you. Floppy doll. Nice and loose. Nice. Good. Piriformis stretch. Holding the piriformis and then stretching it out by rotating the foot away. Feels good. And a sacral float, tuning into the orientation of the sacrum. Yet another flat plate of bone in a triangle, feeling into how it's positioned, how it moves, blood flow, the rate of the breath, and the pulse of the cerebral spinal fluid. Feeling the beautiful energy arrive, circulate through sacral 2, make a U-turn and go back up the cerebral spinal fluid canal of the dural tube. There it goes. And again. And again. And then connecting with the top of the spine, cranial sacral, feeling the energies surround the brain, come back down the spine, wrap around sacral 2 and back up again. It's just a beautiful thing to witness. This also has the added advantage of helping with any mental stresses, and just calms and settles. Very peaceful. Beautiful pulse. Okay, So in your own time, nice and gently, if you'd like to come up and turn over, lie on your back.
Thank you.
Oh, ankles. Can you feel that?
I felt the one, yeah.
Yeah, they're both going, but this one was a bit louder. I think that's better. There you go. Right. It looks better. Yeah, okay, this knee. So, let's have a little feel. A little tuina, just to feel into the soft tissue and agitate it a little bit, see what it's telling me. And then around the patella, which is really clunking. Can you feel that?
Yeah, I can feel it, yeah.
Yeah. Nothing bad, just needs a little bit of TLC. So I'm picking it up, raising it, and then, oh, it doesn't want to be, but rocking it from one side to the other. Feels like it needs a bit more space in there. Is this the knee that had the op?
It's the other one.
Okay. Interesting, because this one came up in the tests earlier.
Yeah.
How is the knee that had the op?
Yeah, I would say back to normal. Only after a really, really long day of walking can I feel it slightly, but it's not painful. Like, you can just notice it a bit more.
Okay. Okay, what, tight you mean, or just tired?
I think just a little bit of an ache.
Yeah.
Yeah.
Okay. Interesting. So just remind me and the viewers what was up with it, what happened?
It was a meniscal tear caused by a hockey injury, most likely.
Okay. A hockey ball?
No, I think it wasn't one incident.
No.
I think it's just the positioning, how you're always squatting, and then there's lots of twisting and yeah.
Okay. Do you play hockey now?
I haven't.
No.
I haven't since uni. No.
Oh,
Yeah.
bet you miss it.
I do, yeah, but
Yeah.
it doesn't work with work, unfortunately.
No. So you had the op to repair the tear. Yeah.
Yeah, they just sewed it back up essentially.
Okay, so they didn't need to replace anything.
No,
Don't know if they can they?
I don't think so.
No.
Not yet.
Oh, that's better. Yeah, the odd clunk. Not as bad as it was. That's good. So what I'm trying to do for you, ready for Killy, is spot anything before it goes wrong, because I know you haven't come with any particular problems. So I just want to make sure your body's okay and ready, prepared, and nothing's going to surprise you.
Yeah, perfect.
Yeah. Like your knee. But I think your knee's fine. It just needed a bit of TLC. And a little qigong, getting some light in there. Imagining beautiful white light coming down, resting on the knee, infusing through and filling the knee with beautiful goodness, health and healing. Feeling that energy, that beautiful lightness, brings space, expansiveness, gorgeous energy to the knee and the whole area, going up the leg, down the leg to the foot. As the knee is a vital component within a large limb. Bringing the energy back to the knee again. Consolidating and concentrating that energy back to the patella. Surrounding with a protective layer. And resting. Okay, the opposite elbow. Just having a little feel. Feels all right. Okay, let's do a bit of repatterning. And the other way. Nice. Good, flexible joints. Your tummy's saying hello. Have you had lunch?
I have, yeah.
It's a compliment to a therapist because it shows the client's relaxed. Okay, relax, relax, relax. Let it go heavy. Nice. Is the heated couch nice or too warm?
No, it's really nice.
Oh, good.
Yeah.
A little bit tight there. I'll come back to that. Just going to pick your hair up and dump it over the back. Lovely, thank you. Okay, so feeling into very top of the spine, about T4 and 5, up to T1, the big bony protruding one, back down again, shifting them left and right. In fact, I might go further down. Yeah. That's the one, it's that side. I'm going to overrun a bit with time. Is that all right with you, Millie?
Yeah, that's fine.
Yeah, good. Okay, then up the neck. Ooh, hello, that one. Okay, heavy, heavy, heavy. Got you, got you, got you. Just going to remove the pillow. Okay, heavy, 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 heavy. And let go. Let your head tip all the way back. Beautiful. Okay, keep going, that's it. So I've got my fingers in a line at the very top of the spine, beyond the C's, the cervicals, and just underneath the occiput, where there is a little gap, and creating a hinge point. Okay, I'm going to have a look at the neck again. Heavy, 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 let go. Oh, that's the one. And then up again to the very top. Let go, heavy, beautiful. Lovely. And the more you let go, the more weight there is. This will really help the rest of the neck by creating space so each vertebra has room to move independently. And then turning to have a look at the vertebrae, just shifting each one so that your head is nice and heavy into my hand. Lovely. Nice and loose. I know it's difficult. And then testing and shifting each vertebra separately down to T1 along the 7 cervicals. Very good, very good. And then along the processes, turning them around, yeah, so that the neck turns, the head turns. And let go, heavy into my hand, lovely. Pushing that spinal process of about C3, rotating it more to the left. Nice. And the other side. Okay, let go, I've got you. Good, so pushing each process, oh, that's the tight one. So just holding for a moment longer than the others to encourage the process round in a rotation to the right. And the more the fascia allows that to happen around that process, the more it'll help the rest of the neck as well. Not just mobility, but so much from here. Sleep, reducing headaches, mental cognition, memory, clear thinking, the workings of the throat, ability to communicate, because it's all the blue chakra, the throat chakra, Vishuddhi. There we are once more. And then into the back of the spine. Lifting again, lovely, really good. Tilting all the way back. A nice heavy head. And stretching. Pushing one shoulder down, bouncing it away. And stretching the neck away from the shoulder point and around the other way. And coming back, retrieving the pillow. Just raising the head briefly, one hand under, and letting the head roll where it wants to. This is for a beautiful frontal bone and occipital release, helping mental clarity and any stresses and strains to disappear. Okay, taking a nice long breath. Feeling your oxygen penetrating your body, infusing through every cell. Feeling the breath arrive at palms and soles. And gently stretching through every finger, widening the palms, maybe circling into the wrists. And then same for the feet, separating the toes, stretching the soles, turning the ankles. And then maybe a turn or two to the shoulders. And the other way. And a long whole body stretch, bringing the arms up, breathing deeply. Absolutely fantastic. Maybe do a banana one side and the other. Back to the centre before coming back down. You okay?
Yeah.
I haven't quite finished. I've just got a couple of retests to do of things that weren't happy earlier. Let's see.
Okay.
So, can I have your left arm and your left leg together? I'm going to push, you're going to hold up strong and hold. Yay! And the other side and hold. Oh, really strong that side. Good. You just had a little shake on your left, but nothing like it was earlier. So, this knee. Arm on its own and hold. Brilliant. This elbow. And hold. Really good. Wonderful. And lastly, the right ACES. So this push and arm again and hold. Fine. Yeah, it's so much easier to do those tests afterwards. It feels like I'm not pushing as hard as I was at the start. I am, in actual fact, I'm trying to push a little bit more to sort of prove to your body, your mind, and me, my notes, everything, that it's definitely better.
Yeah.
I don't need to do those retests at the start, at the end, but not for the therapy itself, but it's more of a confirmation. Things are good, and you can go away feeling prepared.
Yeah.
I was thinking of the word preparedness, and I'm thinking, is that a word? I think it is, or have I just made it up?
Preparedness, yeah. Is it?
Yeah? If you were to write it out, you'd think that looks wrong. But I'm thinking that's what this is all about, preparedness, getting you ready for next week.
Brilliant.
So I'm going to be sending you tons of Reiki next week, all my positive vibes for you and your family and all your friends who are going, and just, I'm going to be visualising you every day.
Oh, thank you.
My pleasure.
Brilliant.
You enjoy the treatment?
I did, yeah. Loved it. It was weird because when I was on my front, the shaking one, even though it was a lot of movement, I felt like I could have just fallen asleep.
Ah.
Yeah.
Oh, this one?
Yeah, like
oh, the
I felt
tuina.
really relaxed even though it was a lot of movement.
Yeah, that's my girl's favourite as well. Yeah, it's lovely. It feels like that's what the spine wants. Just feels like coming home.
Yeah.
Good.
No, really good.
So if someone were to say to you now, so what is core?
The word that springs to mind is realignment. I think realigning everything to what it's supposed to be.
Sometimes I say to people, it's like me making your body do yoga.
Okay, yeah.
Because I'm saying, right, I'm going to put you over there, going to bring you back over here, we're going to bounce you a little bit.
Yeah, that's a good way of putting it, yeah.
I don't know. People still wouldn't understand.
Probably not, no.
Well, thanks for coming.
Brilliant, thank you very much.